CCA Exam Prep 2026 Certified Coding Associate. Question 1. What does the acronym ICD-10-CM stand for? International Classification of Diseases, 10th Revision, Clinical Modification. Internal Code of Diagnostics, 10th Revision, Coding Management. International Coding for Doctors, 10th Revision, Clinical Mastery. Institutional Code of Diseases, 10th Revision, Case Management. ICD-10-CM is the standard for diagnostic coding in the U.S. Question 2. In CPT coding, a global period refers to the time the coder has to submit the bill, the period of time during which follow-up care is included in the surgical fee, the lifetime of the patient, the time the physician is in the hospital. The global period covers pre-op, intra-op, and post-op care related to a procedure. Question 3. Which modifier is used to indicate a significant, separately identifiable evaluation and management service? -25, -50, -59, -26. Modifier -25 is used when an E/M service is performed on the same day as a procedure. Question 4. HCPCS Level 2 codes are primarily used for inpatient procedures, physician services, durable medical equipment, supplies, and drugs, laboratory tests only. HCPCS Level 2, National Codes, covers items not found in CPT. Question 5. The main term in the ICD-10-CM index is usually found as the name of the organ, the name of the physician, the condition or disease, the treatment name. Coders look up the condition, example fracture or diabetes, as the main term. Question 6. What does HIPAA stand for? Health Insurance Portability and Accountability Act, Health Information Privacy and Access Act, Hospital Insurance Program and Accountability Act, Health Internal Privacy and Association Act. HIPAA protects patient privacy and data security. Question 7. Which part of Medicare covers outpatient services and physician visits? Part A, Part B, Part C, Part D. Medicare Part B is for outpatient/medical insurance. Question 8. A sequela is defined as the primary cause of an illness, a late effect or condition produced after the acute phase of an illness has ended, a recurring symptom, the first symptom noticed. Sequela refers to a residual condition that develops after the initial illness is gone. Question 9. In ICD-10-CM, a placeholder X is used to indicate an unknown diagnosis, allow for future expansion and fill in positions, mark a code as deleted, highlight a high-cost procedure. The placeholder X ensures the code is the correct length, example, in 7th character requirements. Question 10. The term upcoding refers to coding for a higher level of service than was actually provided, coding the most specific diagnosis, updating the coding books annually, sending a bill to the patient. Upcoding is a fraudulent practice of misrepresenting a service to get higher reimbursement. Question 11. Which organization maintains the CPT code set? CMS, AMA, WHO, AHA. The American Medical Association, AMA, owns and maintains CPT. Question 12. Unbundling is the practice of grouping several procedures into one code, reporting separate codes for procedures that should be reported with one combined code, sending bills to multiple insurance companies, removing a patient from a plan. Unbundling is illegal and results in overbilling. Question 13. A Z-code in ICD-10-CM is used for external causes of injury, factors influencing health status and contact with health services, mental disorders, symptoms only. Z codes are used for wellness exams, screenings, and history. Question 14. Which of the following is an example of an acute condition? Chronic bronchitis, sudden appendicitis, diabetes type 2, osteoarthritis. Acute refers to a sudden onset and short duration. Question 15. The ICD-10-CM alphabetical index is used after the tabular list to find the code first before verifying in the tabular list, to look up CPT codes only by doctors. Standard coding protocol is index first, then tabular list. Question 16. Modifier -50 is used to indicate multiple procedures, bilateral procedure, discontinued procedure, professional component only. Modifier -50 is used when a procedure is performed on both sides of the body. Question 17. CPT codes consist of how many digits? 3, 5, 7, 10. CPT codes are 5-digit numeric or alphanumeric codes. Question 18. NEC encoding means not elsewhere classified, not enough codes, new entry code, needs extra clarification. NEC is used when the documentation provides detail for which a specific code does not exist. Question 19. NOS encoding means not otherwise specified, name of surgeon, needs other symptoms, new onset status. NOS is the equivalent of unspecified. Question 20. Which document is the source for all medical coding? The patient's bill, the medical record/documentation, the insurance policy, the appointment schedule. If it isn't documented, it didn't happen and cannot be coded.